Why are we giving hepatitis B vaccine to a one-day-old child? Hepatitis B, the major vectors for that are it's sexually transmitted or by needles. Why would you give that to a one-day-old child? It's really a profit motive.
Health Secretary RFK Jr.'s hand-picked vaccine panel is set to vote today on changes to the childhood vaccine schedule. That includes recommendations on hepatitis B shots. So the big question they'll be figuring out whether a dose of that vaccine, along with a handful of others, should be given to newborns. The recommendations have been in place for more than 30 years. The vote comes as an internal memo penned by RFK's vaccine chief at the FDA linked the COVID-19 vaccine to the death of at least 10 children. Now, nearly 1,700 children died from COVID from 2020 to 2023, according to data from the CDC. Joining me now to discuss is Dr. Chris Pernell, director of the NAACP's Chapter for Health Equity. So before I get to this vote, can you answer what we just heard from RFK, because this is what we hear in the world of MAHA about this settled science? Why give a vaccine that has aluminum in it to a newborn, especially if their mother hasn't tested positive for Hep B?
Thank you. So the basic understanding that I think it's important for everyone to have is that you want to protect a newborn or a baby when they have the lowest chance of exposure to something that can become life debilitating or even fatal. So a young person, a baby's immune system is complex in nature, and it's actually expertly designed to handle thousands or even millions of antigens, these foreign substances that the baby gets exposed to immediately after it comes out of the sterile womb environment. So exposing a child to a vaccine within the first 24 hours of life, it is not anything that overwhelms the immune system or anything that causes the immune system to work other than what it's supposed to do in giving that person the best gold standard protection.
How big a deal are these recommendations? Because I understand they're not requirements. So if they're just recommendations, why are so many experts concerned?
It's a huge deal. And why is it a huge deal? Because these recommendations then influence the shared decision making between the patient and their provider. These recommendations influence whether or not insurance companies cover clinical preventive services, and vaccines are an example of clinical prevention. These recommendations influence whether families feel comfortable and trust the science and trust a long-standing public health process to ensure that their children are kept safe and that our communities are kept safe in the long run. So any effort to undermine it or to sow distrust could have catastrophic consequences.
We were talking earlier about that internal memo from RFK's FDA vaccine chief, and according to the reporting here at CNN, Dr. Vinay Prasad basically said this, that the agency will adopt a new approval process for vaccines that will require more evidence of their safety and value before they can be marketed. And it mentions stricter requirements for the authorization of vaccines, certain trials, need to prove the shots reduce disease. The reason why I wanted to ask you about this is because the argument is just because it's settled science doesn't mean you can't review it, you can't return to it, and that doing that helps build trust and transparency. What's your response?
I want people to understand what the scientific process entails. When we say settled science, it means that there is conclusive data, conclusive, indisputable evidence of something's benefit and or its safety. So to rehash something is really not being done for a genuine purpose. Rather, it is being done to fuel a political agenda and the skepticism of people who have long sought to undermine vaccine science and vaccine safety in the United States. And it is never appropriate to politicize a public health process, especially when lives are at stake and the most vulnerable lives are at stake.
To that point, I went and did some research in Kentucky. There were 3 infants that have died recently from whooping cough. In Texas, an infant dying from whooping cough amid an outbreak. And then also in Ohio, unvaccinated child who died from complications of measles. And this was the first death from measles in the state in more than a decade. How do you and other doctors respond to questions from parents who, for this whole debate, it has sown more confusion and more doubt?
You know, the patient-doctor relationship is now more important than ever. In healthcare, we talk about shared decision-making, and what's going to happen in those doctors' offices are trusted, confidential conversations that allow parents to even share whether or not they have doubts or concerns without stigmatizing them, and being able to provide hardcore science and proof and reassurance that they are making the right and informed choice and decision to protect their child. We're not talking about a small amount of data. We're not talking about something that there are competing theories on among the majority of scientists. We're talking about well-established, if I could say, bread and butter public health understanding that has saved over hundreds of millions of lives across the globe. And now doctors are going to be on the front line of that decision making. And I'm hopeful that parents will be able to sift through this misinformation and disinformation. But the recent outbreaks that you have described, and unfortunately those deaths, they point to cause for concern.
It's Dr. Chris Pernell. Thanks so much for your time.
Thank you.